Dr. Brenda Watson is my guest. She is on a mission to get to the bottom of what causes heart disease and related conditions. She debunks common cardio myths in an encyclopedic book called Heart of Perfect Health. It is a tome, no question, but all the questions are definitely answered. There was one joke in here, Red Fox, comedian, said health nuts are going to feel stupid lying in hospitals dying of nothing. Right. So, but you're not suggesting we become a health nut. No. You're saying if you have, is it gastro-reflux, leaky gut, whatever, that affects your whole system, your whole body, and the doctors will give you a pill, you know that. But there must be a better way.
There is a better way. You know, acid blocking medication or antacids we buy over the counter are short-term remedies. They're not to be taken long-term. But because I've lectured and talked to thousands and thousands of people, I know people stay on these medications for years. The studies are already showing long-term that if you stay on these medications long-term, your chances of having osteoporosis, C. difficile, antibiotic-resistant bacterial infections.
Well, that can kill you.
Yes.
C. difficile
and it's
horrific.
Epidemic. It's epidemic.
And it's linked somehow to this?
Yes, because what happens is when you destroy the acid long-term in your stomach, it's your sterilization tank. Think about this. It's common sense. You're taking bacteria in every day on food.
Right.
And if you have nothing there to be able to sterilize it, where's it going? Right in your gut.
So if you had it, if you had gastro-reflux, what would you do?
What I would do is I would probably go on a good diet if I had it. Get a lot meaning I would stick to what more protein, vegetables, and fruit. Get a lot of the grains out of my diet because for just a period of time to see if that was because I can tell you I do it all the time and it works. And then what I would do is I would look at probiotics. Taking some high-dose probiotics to begin to repopulate the friendly bacteria because the other things that acid-blocking medication does is it destroys the friendly bacteria.
What depletes friendly bacteria aside from that?
Pesticides in the food, of course antibiotics. Now there's a lot of antibiotics in our meats, you know, so we're taking them in even though we're not thinking that we're taking a prescription.
And you say in our water. In our drinking water. Because people are tossing
pills
and somehow it's getting into the water
and we're drinking it. Those statistics are out there also, Fanny. So we have someone who maybe takes too much over the counter, what we call NSAIDs, aspirin, ibuprofen, those types of things. That destroys it.
So you have arthritis and you need ibuprofen, or you need to do something about your arthritis, which is also inflammatory.
Right.
Take probiotics always with the medication, or what?
Yes, probiotics are totally safe. And you know, even if you do take an antibiotic, most doctors now, and even the pharmacists, are recommending, okay, when you take this antibiotic, you need to be taking the probiotic to replenish the good bacteria.
Okay, what do you make of the wheat belly thing? The wheat belly book.
I have been doing food sensitivity testing for 20 years. So I know that Dr. Davis is on to something very, very cool.
Because it's controversial, as you know.
It is controversial, but when you see patient after patient like he has, and I also work with another doctor down in Dallas called Dr. Kenneth Fine. He's with Baylor University, and he developed a test, stool test. For many years we've been using it that shows gluten sensitivity, not necessarily celiac, but when you're gluten sensitive or dairy sensitive or soy sensitive. And so because I've been looking at that for so many years, and then Dr. Davis comes out with this, I'm like, yes, you're right on.
Okay, but as you know, we humans tend to get on bandwagons. Now, being gluten-free or watching the gluten in the diet is what everybody's trying to do. Should we be?
Yes, well, you know, I have a personal story on that. I worked, as you know, in a clinic for many years, and I always knew about gluten because a lot of my clients were celiac, and the doctor's patients were celiac or had gluten sensitivity. I never thought that I had it. I did like everybody else. Oh, I don't eat much of that. And I really didn't. My diet's always been pretty good, but I didn't have it totally out. And 5 years ago, I started developing problems with my hands and joints. And it got worse and worse, especially, you know, after something emotional happens in your life. My mom died. Right. And my joints swelled up, and my husband's like, this is terrible. I go to the doctor, they say you have arthritis, and I'm like, this is crazy. I'm going to go look at my gut. I'm going to see what's going on. I took gluten out of my diet, and within 3 to 4 months, it does not happen overnight, 3 to 4 months, it's all gone. It was gone. So that pain, I never want to experience again. And it's worth it for me.
Okay. If you have perfect digestion, and I doubt anyone does, but if you have really good digestion, your body absorbs nutrients, you're doing everything right inside, you can still have a heart attack.
Yeah, you can, because people sometimes, I think, Fanny, don't feel what's going on in their bodies when they're, you know, having a heart attack. There's been something going on. So many people call me and go, I went and had a colonoscopy and I have cancer, but I've been normal. I've had normal elimination all my life. And I'm thinking, something was wrong. Right. Something was wrong.
Right, so, something was wrong,
right.
I mean.
Yeah, and the thing is what with, like, as I say, blood pressure. Someone has a heart attack. Well, for 10 years, you can have high blood pressure and you're not checking it. You know that, and then you have a heart attack because it's called the silent killer. You haven't realized that your blood pressure has been being elevated over a long period of time.
If you have high blood pressure, on medication for high blood pressure, and you still have high blood pressure, what can you do?
Well, you can talk to your doctor, number one, about adding in omega-3s and getting the right amount of omega-3s, because, and then that would, you know, really be helpful in the blood pressure, and also looking at the sugar in the diet. I can, in one of the examples in the book, the person was on blood pressure medication, and within 3 months, her and her doctor were able to wean her down with her diet and the omega-3 connection.
The low-fat diet, very popular. Does it prevent much?
No, I'm not a low-fat diet. Now, I'm a good fat diet person, but the low-fat, high-grain diet, no, I'm not a proponent of it, because there's two things that cause problems. One is because they aren't converting carbohydrates to sugar, so they're not aware of how much sugar they have in their diet, and then they're eating high fat. That's a deadly combination. Low fat is not bad as long as you're eating the good fats, your avocados, you know, your good quality, your flax oil, your olive oils, those types of oils. That's very good.
Okay, but just don't dip the white bread in the olive oil.
Right.
Right? Maybe one piece. Because you're not saying we can't eat bread or grains or
no, I'm not saying that you can,
rice.
but you've got to be aware of how much you're eating and what conversion that goes into sugar.
Sure. And we, as you know, don't want cardiac arrest today or tomorrow. And so if right now you were 28 or 38 and you wanted to grow old, really old, like 104, what would you do? Well,
when I see that, I just talked to a 28-year-old yesterday that eats donuts every day, and I said to her, you know, did you think about it, how you want to grow old? And she goes, no, I'm riding this one out as long as I can. And I'm like, and I started laughing. But the point is if I were in diet, exercise, and making sure you have, you know, good quality probiotics, a multivitamin, those types of things, omega-3s, low stress, yoga, those types of lifestyles.
And what about this endothelial dysfunction? What the heck's that?
That's just a very technical way of saying atherosclerosis.
I see. So
heart
clogged
disease.
arteries.
Yes.
Really?
Yes.
What clogs them? Plaque?
Plaque from the elevation of cholesterol, and then white blood cells are attracted, and then, you know, the arteries begin to harden, sort of like leaving a garden hose out in the sun.
Well, we want flexibility in our arteries.
We do.
I know that. How do you know?
Well, I think there are tests. You can absolutely, and in the book, there's all the tests to take to your cardiologist so that you can look and see what's going on.
Okay, and apparently it's important we drink tea.
Yes, tea's excellent.
Why tea? What kind of tea?
Well, it has green teas. All of our teas have antioxidants. They're very helpful. And you know, the big thing today is green tea with weight loss. I mean, there's a lot of information out there about teas, and it's a very good way to, you know, get antioxidants in our body.
And sleep, important, not important?
Yeah, but people are different. Some people need more than others. I need more sleep. My husband needs less sleep. It's just we're different.
What about wake up in the middle of the night?
That's not good, and that's not good.
What's causing that?
Stress.
Do you have any insomnia? Yes,
stress.
Okay.
Or as women get older, their hormones are out of balance.
You noticed. Mm-hmm. So do you take a sleeping supplement?
I take sometimes melatonin, which is a sleep that you can purchase at a health food store.
Right.
I also take sometimes something called 5-HTP, which is another supplement that you can buy. But once I began to use bioidentical hormones as I got into my 50s, I'm 60 this year. So when I got into...
You're not.
Yeah, I'm 60 years old in 2 months. So when I got into my 50s, I started having the postmenopausal symptoms, I began to use the progesterone and the natural creams that you get from your doctor through the pharmacy, and it totally changed my life.
So get the hormone file, know what's going on in your body, and the good news is about this, it's a cookbook too.
I know.
I know, the beef and veggie bolognese and blah blah bolognese and the seared sesame tuna and the chicken lime cob and all of that. So there's meal planners and recipes.
Yes.
So he can make you dinner.
Yes.
Isn't that how it works at your house?
Yes. It changed our life. He started cooking.
I love that.
Not kidding, after
this
20
is good.
years.
You go on the road, dear. Make the money, and I'll cook.
That's right.
Why not? How nice to see you.
Thank you.
Thank you. Dr. Brenda Watson, Heart of Perfect Health, the startling truths about heart disease and the power you hold to stop it or reverse it. Remember, you can catch our conversations on YouTube or follow me on Twitter at Fanny Kiefer. There will be many more insightful, out-of-the-box thinkers to come. Thanks for watching Shaw TV and being with me today.